And then next, I'd like to invite Pauline, the advisor from Taiwan Biophotonic. He's going to talk about non-invasive wearable monitoring technology. Let's welcome Paul.
Hello, nice to meet you. And hello, everyone. Good afternoon. It's my honor to present our company and our product. And I should apologize because I got to catch a cold, so my voice is terrible. So please forgive me. So I just try to speak loudly and clearly. First of all, TBPC, the core value, we want to establish the foundation, and maybe you can paraphrase this platform to the preventive the medicine through the wearable device by the no invasive monitoring technology. This is our vision. We aim to build up a world with the equal right to the medical care to the human being. It means no matter what you are rich or poor, no matter what's your skin color, you can use our monitoring the technology and detect your health. So the TBBC in the non-investing the wearable monitoring, we have the three characteristics. First, the 3R, and the first R is relief. Relieve the pain in the convenience for the traditional the detection device. The second one, we remove the restriction at location. Third is the most important, is the profit, the revenue. We can share the whole shareholder and the stakeholder, of course, of our customer, our friends. So the company profile, the TBBC is, as I mentioned, the practice preventing the medicine, the company. So we have our 16.8 patent in our hands. So you were just wondering what the purpose and the TVPC to focus on. Actually, it's for the sleeping problem, like, for example, like OSA, insomnia, and then maybe you can say the COVID-19, the COPD, uh, everyone, any one of the alarm, it's relative to the pulse and the SpO2. We just, this is our first step to detect the characteristic. So you're just wondering why we are just building on the 8 years ago and to now, and we just try to the approach to the end customer to the marketing. Yes, we just step by step. Once we get the FDA already, yes, once we got the TFDA, FDA, CE, and Japan, the FDA is being the Panda. Yeah, and the truth. So it's 2 years ago, we just start to share our information and do some cooperation with this marketing. But the 8 years, in the 8 years ago, between the 8 years, we had a lot of the cooperation with on the clinical trial to the Taiwan famous hospitals already. So as our insight, maybe you say everyone just have the wearable device. So what is special? What the TVPC can do? As I mentioned before, first of all, we just detect our SpO2 and our pulse by medical condition. Of course, we can already got the FDA, TFDA. So our application in first of all is OSA, and the second one, once we developed our blood pressure, and we can uh, detect the more or prevent more disease like CVD, like COPD, and of course like the insomnia and some kind of the sleeping problem. So our corporation, as I said, we are to provide a platform. It means that in the beginning, we developed our own sensor, and eventually we just developed our platform and our motherboard, and our software, the algorithm. In the end, we already developed our watch, the watch for the OSAT detection. And of course, our corporation is not limited by the wearable device only. Of course, we have a lot of kind of the cooperation with the, if you want to more some specific application. For example, you want to use in the hospital, you want to in the personal, you want to use in the sleeping center, you want to use it for your home long long distance home take care. Of course, we have all of the opportunity to cooperate with this. And as I say, what everybody say, well, it's very similar like Apple Watch, but we just mentioned we are a medical device which can detect the OSA, the characteristic. So as we just spend 8 years to get this license, a certification. And what's the difference between another wearable device? First of all, when I say we are the friendly using, as I remember, as I mentioned, that we release and release your pain and the inconvenience. You don't need to wear a lot of the machine. When you go to the sleeping center, you want to know what's your OSA situation. In the Taiwan, you will spend maybe 1 night, but you need to wait. You need to wait 2 or 3 months. Of course, in the American, the span is very huge. I mean, I remember it's just 8,000 US dollar just for 1 night to detect your OSA problem. But once used our TVPC, the product, we want to be quick scanning. You need to get a long line to go to the hospital, to the sleeping center. You just wear our TPPC, our product, and just sleep at home. And you can just upload your data or offline. Of course, offline you can bring it back to your doctor, and the doctor will say, yes, you got a big problem. Please go to the hospital. If you have maybe maybe your problem is not so terrible, maybe you can do some preventing, for example, like giving a simple surgery. Maybe you can you can look at for your dental doctor to solve your also the problem. So our technology, our sensor can get through the skin the color. Of course, the PPG signal is means is a logical, physiological lighting sensor. You can detect the more specific, more accuracy. So the patient, of course, using friendly. So you need to wear the too much the so I say don't need to wear too much the machine, and you just use it in on your arms, in your hands, and go home and sleep maybe 2 or 3 days, and I can do the quick scanning. So it will be a lot of saving money and saving time to our patient, to our hospital, to our corporation, the partner. It means we can practice our idea for the medical right equal. Thanks you very much. And if you have any question, please contact the ITCI, ITI, the QR code, and you can ask me some question. And thanks for your time.
Again, welcome to scan the QR code. And I think there's a lot to talk about with Paul. So if you're interested to them or to their company, is the time to scan your this QR code. Thank you so much.